Okay.
Whenever you're ready.
Yeah, okay. Hi, good morning. Good morning. I'd like to welcome everyone to the Wyndham Senior Center. Today we're very fortunate to have a very good friend of Wyndham and Wyndham seniors. He works hard for seniors. He understands the concern about rising costs of health care and the cost of living, and he's working very hard in Congress to help seniors. So I'd like to, I don't want to delay anymore, and so I'd like to introduce you to, I'm sorry,
It's great, you're doing great.
Congressman Joe Courtney.
Great, thank you very much. So thank you for your kind introduction and invitation to be back here. I've been here a number of times before, and full parking lot, parked on the street, that's a good thing. And you know, there's no rush here today. We'll be about an hour or so, and I'm not going to give a big long monologue, filibuster. Just gonna, and you know, we hopefully can have some good dialogue. And again, we're not limited to just questions around Medicare and Social Security. If other people have other issues, we're happy to talk about it. I was over at the Mansfield Public Library the other night. We had a packed house. The focus there was on the Middle East and foreign policy issues. I was up at the Hebron Senior Center about a week or so ago. Again, open, unscripted event, and again, we welcome the interaction. Last night I was with the Connecticut Farm Bureau, because I sit on the House Agriculture Committee, and we were talking about issues regarding the Farm Bill and immigration reform, which again, for farmers in eastern Connecticut, these are almost existential life or death questions, and obviously they're still pending in Congress right now. So just in terms of a quick snapshot and overview, because I was already asked, where does Social Security stand right now? I just want to again give you a quick sort of, again, update. And then again, we can sort of open it up for dialogues and questions. So, I want to begin first of all by saying that, a few weeks ago, Medicare celebrated its 48th birthday. Okay, 48 years ago, Lyndon Johnson signed the Medicare law in Independence, Missouri, with Harry Truman looking on. Again, when he was Senator Truman from Missouri, he was somebody who was pushing for a universal health care plan for seniors. And he lived long enough. He and Bess Truman were issued the first two Medicare cards after the law was enacted back in 1965. And sometimes when we talk about Medicare, it does, I think, help a little bit to talk about what the world looked like at the time when Medicare was first enacted. Only half of America's seniors had health insurance in 1965. Insurance companies regarded people over age 65 as either too great a risk to even write policies or too great a risk to write affordable policies. And life expectancy in 1965 in America was age 70. Okay, you fast forward to today, where we are after Medicare has been in place for 48 years. Again, it's virtually universal coverage for anybody who's over age 65. Again, it's basically operated as a pool where the government issues Medicare cards for people upon their 65th birthday, and we got somebody who's about to turn 65 right here, and I'm right behind you. I just turned 60 in April, again, obviously the issues of solvency and the strength of the program are critically important for you and for me and for our children and grandchildren, frankly, even more importantly. But again, I think, when we look at what's happened since Medicare was passed, life expectancy now in the U.S. is age 79. And, there's lots of reasons that I think people can point to in terms of why life expectancy went from 70 in 1965 to 79 today. Part of it is, nutrition, just basic health, lessons that people have learned. But there's no question having access to medically necessary care, which is the definition of Medicare, has still been a critical reason why people are living longer. And that's a good thing in my book. My dad, who I was his medical power of attorney, passed away at age 84 back in 1997. He was a lifelong Republican, diehard Republican, but I remember taking him back and forth from L&M Hospital. He was battling congestive heart condition. We'd sit there at the kitchen table and go through, this is not a bill, forms, which many of you are familiar with, But I can remember him saying, thank God for Medicare, because again, it made sure that he was able to get the medically necessary care. And I don't have to tell anybody, congestive heart condition is a tough one in terms of you know, the chronic nature and painful nature, frankly, of that illness. And everybody's family here, I think, can you know, probably tell similar stories in terms of, you know, what Medicare has meant in terms of just making sure that people get at least a basic level of health coverage. Now, it's not perfect. There are you know, issues in terms of you know, coverage and different services that sometimes you have to battle your way through the system. I want to again take a moment and recognize Dorothy Grady, who's in the green jacket here, who is my Medicare and Social Security caseworker and does great work. Dorothy hails from Coventry, Connecticut. She was Human Services Director for many years, and again, she's on the phone every single day dealing with those issues. And just up the road a little bit, we got the Center for Medicare Advocacy, which is the office in Mansfield that provides free services for people who, again, have issues with Medicare. There's seats up here, if you guys, there's seats up here if people want to find a seat. That, you know, provide people with a free lawyer, basically, in terms of issues regarding Medicare coverage. So, Social Security actually just celebrated its 78th birthday, and again, it's a program which, when it was first created, the majority of seniors in America lived in poverty. I mean, that's a fact, that's not an opinion, and today it's below 25% of America's seniors live in poverty. Social Security has provided a basic floor of income for individuals' retirement income. But I think it's also important to remember that Social Security also provides benefits for surviving children whose parents have been taken from them. I have a brother who died at age 26 and left a 2-year-old, and Social Security was there to make sure my nephew Christopher and his mother had a basic support system, so that, again, losing his dad to cancer, which is what my brother passed away from, again, didn't just sort of capsize or bankrupt the family. There's 7 million children in America today that receive Social Security benefits because of parents that they've lost. People on disability also qualify for Medicare. Again, it's a threshold you have to go through a hearing process to get to. So, you know, again, Social Security is not just a retirement program. It also provides family support, social insurance for families whose parents of children have died prematurely, and also for individuals who suffer from chronic illness as defined through the Social Security system. The trustees for Medicare and Social Security is the nonpartisan oversight group that year in and year out issues an annual report in terms of the health, financial health of the Social Security system and the Medicare system. They just issued a report about a month or so ago. Again, just in terms of immediate issues before the people that are here in this room, they projected that Social Security will have a cost of living adjustment for next year of between 1.5% and 2.5%. Again, it's usually a little bit later in the fall that the Department of Labor calculates the cost of living adjustment formula. Again, Congress doesn't vote on COLAs. When the COLA system was created back in the 1970s, it's an automatic system that's calculated using a breadbasket of different goods and commodities that, again, projects what the cost of living is. And at this point, the trustees were projecting that the Social Security COLA for next year will, again, be between 1.5% and 2.5%. In terms of Medicare's projections for next year, again, because a lot of you pay Part B premiums, again, they have basically projected that there will be roughly a 0 increase in terms of Medicare Part B for next year. So I know some years in the past, you know, when there's been a COLA, looks great, but then your Medicare premium, Part B, goes up, and that eats into the COLA. But this year, it looks like whatever COLA is awarded is going to be pretty much, you know, unaffected in terms of Medicare Part B premium. And again, that came from the trustees' report, okay, that just was issued recently. The so again, for people who are on Medicare and Social Security, again, you're looking at a COLA for next year and pretty much a 0 increase in terms of Medicare Part B premiums for next year. In terms of solvency for the Social Security system, again, the trustees' report came out and said Medicare is fully solvent through 2026. Again, it doesn't go to 0 bankruptcy in 2026. And again, as a 60-year-old, I read this one pretty closely, okay? But there's a shortfall after 2026, as there has been many, many times since Medicare was first enacted in 1965. There was one moment in the 1970s when Medicare's solvency projection, according to the trustees, was only 2 years. Again, back in 2007, 2008, it wasn't even past 2020. Again, we're now at 2026. Again, the trustees' report has a lot of analysis in terms of why it got pushed out to 2026. There's no question that the Affordable Care Act, in terms of the reduced reimbursements to the Medicare Advantage program, is one of the areas they specifically identified as why the system is stronger financially. Again, Medicare Advantage, despite a lot of the worries that existed back in 2010, has not collapsed. In fact, enrollment of Medicare Advantage since 2010 has gone up, not down. And the premiums on Medicare Advantage have pretty much held level. Again, very soon, you're going to see Connecticut, a lot of the providers of Medicare Advantage, they're going to be on the TV airwaves selling their product like they do every fall. And the Choices counselors here in this senior center and senior centers all across Eastern Connecticut are going to be sitting down and going through the different plans offered by Medicare Advantage. And the same is true, by the way, of Part D, the Medicare prescription drug program, is that they projected virtually pretty much zero increase in terms of the premiums for next year's offerings. But again, I know you've got great help here in the senior center. That
the Choices counselors.
Help me out.
The Choices program is really, I think, one of the most overlooked, under-recognized heroes out there in terms of helping people try and navigate the system that's there. But again, in terms of a lot of the worries that people had back in 2010 when the Affordable Care Act was passed, again, there were mailings that were going out into the district saying that Medicare Advantage programs were going to be canceled. That has not happened. And in fact, enrollment has gone up in terms of the Medicare Advantage programs. Again, whether the Medicare Advantage program is a good idea or not is obviously a personal decision that people have to really be very careful about in terms of what the network of doctors and hospitals that are included. And again, we've got people here that can probably speak about that even more powerfully than I can. I'm going to talk about one more other issue for Medicare. And again, there's people who've been coming in. This session is not limited to Social Security and Medicare, but obviously, we wanted to focus a little bit on that because where we are here today. But there's a very serious problem that's been going on with seniors on Medicare who are being treated in hospitals and need help when they get discharged at nursing homes or home health care services. Again, going back to my dad's example, which I mentioned earlier, when he had congestive heart condition and was in L&M hospital, when he was there right before he passed away, he was there for over 3 days. Okay, and then when he was being discharged and he was getting weaker and weaker as time went on, it was pretty clear he couldn't control his illness at home, even with home health services. So we had to reach out and get help from a nursing home, and where I live up in Vernon, Fox Hill Nursing Home was the facility that we chose because it was close to my house, and my wife was a nurse, we could get over and see him. And back then, the rule was very simple. If you spent 3 days or more in a hospital, that triggered Medicare coverage for follow-on care at a nursing home or home health services. Now again, as many of you know, Medicare does not cover nursing home coverage entirely, but it does cover up to 100 days of rehab care when you've hit that 3-day threshold of being in a hospital, okay? And that's always been the operating principle. If you read the statute, the Medicare statute, it says if you have 3 days under hospital Part A, under Medicare, you're qualified for nursing home coverage. Well, what's been happening, and this goes back to the early 2000s, is that the government, the Center for Medicare Services, has been doing much more aggressive auditing of hospital billing. And when they determined that the person who's in a hospital really shouldn't be covered by Part A, but they should be covered by Part B, which is the outpatient Medicare coverage, hospitals have to code it in or enter or designate the patient as observation. Now it sounds kind of semantical, okay, like just wordplay. But if you are treated as observation as opposed to inpatient, that has a huge impact when you're discharged from the hospital, because you could be there 5 nights, you could be there 7 nights, and we know there are cases like this. And if you're designated as observation, then you don't qualify for nursing home coverage. So the family in Norwich who called our office and said that their relative fell in his apartment, hurt his hip, spent 5 days at Bacchus Hospital. When the daughter-in-law came to pick her up, and the hospital told her, you know, your father-in-law was a observation patient, not an inpatient. You know, that didn't mean anything to her. It wouldn't mean much to anybody. You know, when she went to the nursing home, they told her, "Sorry, you're going to have to write a check for $10,000 if you want to have this person admitted." Now, this is not a random, isolated incident. Because hospitals are getting so gun-shy about coding people in as inpatient because they don't want to get audited and have to pay back money or penalized, they are being much more careful about treating patients as observation. The Inspector General's office issued a report not too long ago that said 600,000 people across the country were in hospitals for longer than 3 days and treated as observation patients. And as a result, and I was over at St. Joseph's convalescent home not too long ago. There was a gentleman there who this problem happened twice in his family, where they had to write big fat checks to make sure that his wife actually was admitted into a nursing home. Again, it's important to remember that these are people, when they go to the nursing home, it's because the doctors are telling them they need to go to the nursing home. I mean, this is not because they just want to go there and they want the government to pay for it. It's because they really are not ready to go home and live independently. And so I've introduced legislation for the last 3 Congresses. It's the Medicare Access Act, which basically says 3 days are 3 days. Okay? I mean, if you're in for 3 days, and if the hospitals and the government want to fight about whether it's billed under Part A or Part B, they, you know, go ahead and kill yourselves. You know, knock yourselves out. Okay? But if a family and a patient has been there for 3 days, that should not interfere with Medicare paying for their nursing home coverage if a doctor prescribes it as medically necessary. First year I introduced it, first Congress, we got only 11 co-sponsors. Last Congress, we got 33 co-sponsors. This Congress, we're up to 93. Okay, we have Republican and Democrat support. Tom Latham from Iowa, Republican from Iowa, is the lead co-sponsor along with me. We are getting serious traction on this issue. It has been endorsed by the Emergency Room Physicians Association, the AMA, Nursing Home Association, ARP has endorsed it, because again, all these groups are running into this problem over and over and over again. And what's happening is that families either are having to, you know, cough up big bucks to get somebody into a nursing home, or they're just taking them home, which is not safe, okay? And they're ending up a lot back in the emergency rooms, which is why the emergency room docs have now sort of joined on to this legislation. And I know this issue has popped up in this region a lot, and I'm actually optimistic. I've talked to a number of my Republican colleagues, you know, particularly Latham and Peter Roscom from Illinois, and we are feeling actually pretty you know, positive about the fact that we're going to fix this problem so that we can make sure that families who need follow-on long-term care or home health care services are not going to be denied that care because of an issue in terms of billing, you know, categorization that's there. And so anyway, I mean, that's sort of the quick sort of snapshot and update. And as I said, we're here for a while. I'll be happy to take some questions. And again, I want to thank the home for the center. Sorry, instead of nursing homes, the center. This is not a home. You know, for hosting this event. And by the way, we've talked about some of the plans here for a new center in town, which I see Dawn White is here from the Niles.
My mother's name is White.
That's right. I still think of your family as Whites.
I know.
But again, you know, if we can get this town deserves more space. I mean, just, I go to there's 65 towns. I go to a lot of senior centers. Down in Rocky the other day, I was up in Ellington. They're building a new one. Vernon, where I'm from, you know, they've got a nice senior center, and you know, really anything I can do to help with that effort. You guys, you really deserve it.
It's actually stuck in bonding, so we're
Right.
waiting for it to get out of bonding. But we have a meeting with Susan Johnson. I do.
Yeah.
Actually, next Thursday to talk about how to get it out of bonding.
So good. So with that, you know, and again, if you want to.
No, but if anyone has any questions for Joe, if you could, when you do ask a question, just please speak loudly so